Hi, I'm Dr. Laura Lozier from Muskegon Surgical Associates. I'm here to talk to you a little bit about breast surgery. We see patients in our office for a variety of breast problems, including benign masses, breast cancer, and other infections or other questions. Referred from a variety of places, including the breast center and family practice doctors. And we're happy to see anyone who might have a question or a concern about something going on with their breast. When you're seen in the office, we typically start with taking history and asking you a little bit about yourself, and then we'll proceed with doing an examination of your breasts. We like to inspect the skin of the breast and then do a brief exam to feel for any masses or lesions that you may have and to check for the lymph nodes underneath your armpits. If we're concerned about something with your breast or want to check it further, we may order a variety of studies, including an ultrasound or a mammogram, to get a better idea of what the breast tissue beneath the skin looks like. If there is something of concern and we feel that you need surgery, there are essentially two options for breast surgery that we may discuss with you. The first is a lumpectomy, or removing a portion of the breast tissue. A lumpectomy is typically done as an outpatient surgery. You have a small incision on your breast over the area that we're concerned about, and we will remove the area of breast tissue. We may need to localize that area with a radiology study beforehand. If this needs to be done, they would place a wire or a needle to point at the area of concern so we know which breast tissue to remove. Once the tissue is taken out, it will be sent to the pathologist to be evaluated, and this typically takes 3 to 4 business days, and then you receive a call from our office afterwards with the results. If we feel that you need more breast tissue removed, you may need a mastectomy, or removal of the entire breast. When a mastectomy is done, you typically stay in the hospital overnight, just for observation. As long as you're feeling well in the morning and your pain is well controlled, you're able to go home that day. After a mastectomy, sometimes a drain is left in place. This is to allow any fluid that collects at the area of the surgery to drain out so that the skin heals down well. The drain can be removed in the office 1 to 2 weeks after the surgery, once the amount of drainage has decreased. Post-operatively, a lumpectomy typically has a quick recovery. Breast surgery is generally not too painful. The risks associated with this may include a fluid collection underneath the skin where we removed the area of breast tissue. Sometimes you feel a hard lump in this area as that fluid collects, but your body will reabsorb that and nothing more typically needs to be done. After a mastectomy, the recovery may be a little more prolonged. People feel generally sore in the chest wall and the armpit after this, and need to limit their activities for a couple of weeks. We do recommend slowly going back to normal activity and working to stretch out that arm, chest, and shoulder on the side of the surgery. We may recommend that you see a physical therapist or be seen at the lymphedema clinic at the breast center to help with this. As I said before, we see a variety of different breast concerns in our clinic, and every patient is unique. We can discuss the particular details of your case when you come in for an office appointment. If you have any questions about a lesion, a lump, a bump, discharge from your nipple, or a skin change on your breast, please don't hesitate to call our office at Muskegon Surgical, and we're happy to schedule you an appointment to be evaluated.